Welcome to Hope Natural Health, the podcast inspiring you to be your best version. Join me, your host, Dr. Erin, naturopathic doctor, dog mom, cancer survivor, and girl boss weekly as we discuss all things health, hormones, and happiness with a little side of this thing called life. Welcome back to the podcast. Last week, we discussed stress resilience and HRV, or heart rate variability, with guest Greg Elliott. It was an awesome episode, so take a listen to that. And now this week, I'm going to be discussing endometriosis versus adenomyosis. And what's the difference? So endometriosis has been a hot topic as of late, so I figured I would provide some designation between the two because they're very, very common symptoms in female reproductive years and also can be a cause of some menstrual irregularities. So in endometriosis, cells that line the uterus grow outside the uterus. The cells can grow anywhere, which is why it's so painful. It's commonly diagnosed earlier in our menstruation years, and it's estimated that you have a 7-time increased risk of developing endometriosis if you have a blood relative that has already been diagnosed. Symptoms can include anything from pelvic pain, pain during bowel movements, fatigue, and even nausea. The Endometriosis Association states that period pain is not normal, and it can affect women all across the world, regardless of race, class, or socioeconomic status. Endometriosis can start very, very young. Many of the members report that they have had symptoms since their very first period. Endometriosis is primarily an imbalance in the immune and endocrine or hormone system, and the presence of lesions in the pelvis is the tip of the iceberg. Endometriosis is not completely cured by surgery alone. The underlying environment throughout the whole body must be addressed in order for the women's health to be truly improved and to hopefully avoid other problems related to the endometriosis. It's also not cured by pregnancy. Some women do have relief of symptoms during or after a pregnancy, but others actually have worsening symptoms. A woman should never be pressured into having a baby as a treatment for a medical condition. Environmental toxicity, which I talk a lot about on this podcast, plays a critical role in the development of endometriosis. The association discovered in its original research that dioxin can lead to the disease. Dioxins are found in pesticides and contaminated food grown with pesticides. So eat organic. We want to look at the Environmental Working Group's Dirty Dozen to see the most contaminated foods with dioxin and obviously avoid those. Many other health conditions are found at higher rates in women with endometriosis, such as irritable bowel syndrome, migraines, allergies, intestinal dysbiosis or leaky gut, hypothyroidism, plus a higher risk for numerous cancers, autoimmune diseases such as MS, lupus, and heart disease. Diet and lifestyle changes do make a difference. So while medications and surgeries are important options for women suffering with endometriosis, it's important to do what you can. Take your health into your own hands with the choices you make every single day. The Endometriosis Association is working very hard to make real change in the medical world so that women and girls with endometriosis can have the very best care and treatment options available to them. So that was taken directly from the Endometriosis Association, so I wanted to read those steps to you. And now adenomyosis is very similar, but the cells that line the uterus grow inside the uterus instead of outside the uterus, which causes an enlarged uterus. So this commonly occurs later in our menstruation years, and it doesn't have a common genetic disposition like endometriosis. But if you have had any pelvic or uterine surgery, you are at a higher risk. Symptoms also include pelvic pain and pain during or around your menstrual cycle. So this condition affects 20 to 35% of females. So you can see there are some similarities and commonalities between the two. I would say endometriosis is way more common than adenomyosis. But if you're experiencing debilitating period pain, which is not normal, ask your doctor for some further testing, maybe a pelvic transvaginal ultrasound to take a look at that endometrial lining to determine if, there's abnormal cells either inside the uterus or outside the uterus that can be causing your period pain. So have you been diagnosed with either of these? I would love to hear your results, what you've done to help yourself. And if you have any questions about either one of these, you're always free to reach out. So with that, we'll wrap up this episode, and I'll see you all again next week.